11 years, 200 dogs, 34 years inside the operating theatres of Johns Hopkins, and one name absent from the 1945 paper that defined modern cardiac surgery. This is the case of Vivien Thomas and the missing intervals. Most people who have heard of him know one image: a tall black man standing on a wooden stool behind a white surgeon in a Baltimore operating theatre on November 29, 1944, guiding the first surgery ever performed on a so-called blue baby. That image is real. It is preserved at Johns Hopkins. But it is the end of a story, not the beginning. The short you may have already seen showed you the operating theatre. The case file you are about to watch is about the 11 years before the operating theatre, the laboratory in Nashville, the assistant pay grade, and the 200 dogs nobody wrote about. Vivien Theodore Thomas was born on August 29, 1910, in Lake Providence, Louisiana. He grew up in Nashville, Tennessee, where his father worked as a carpenter. He told his family from early childhood that he intended to become a doctor. While still in high school, he took an after-school job as an orderly at a Nashville hospital. He saved every dollar. By 1929, he had enough to enroll at Tennessee Agricultural and Industrial State Normal School, what is today Tennessee State University. Then the stock market collapsed. In October of 1929, the bank holding his savings failed. His tuition was gone. He left college and took work as a carpenter. He was 19 years old. In February of 1930, he was hired at Vanderbilt University Medical School. The job description was laboratory assistant. The pay grade was janitor. He was assigned to a young surgeon named Alfred Blalock, who was researching hemorrhagic shock. What happens to the human body when it bleeds too fast? He stayed in that laboratory for 11 years. This is the interval the textbooks skip. By the end of the first year, Thomas was performing surgical procedures on dogs that no other technician in the building could perform. By the third year, he was running the laboratory while Blalock taught classes. By 1940, he was co-designing the shock trauma protocols that would, within 5 years, save thousands of Allied soldiers wounded on the beaches of Normandy. The plasma transfusion technique used in field hospitals across Europe and the Pacific was built on the work Vivien Thomas did at Vanderbilt, on a janitor's pay grade, in a state where he could not legally sit at the same lunch counter as the surgeon he was teaching. In 1941, Alfred Blalock was offered the chair of surgery at Johns Hopkins. He accepted on one condition. Vivien Thomas had to come with him. They arrived in Baltimore in the summer of 1941. Thomas was 31 years old. He had no college degree, no medical credential, no surgical license. Johns Hopkins did not have a payroll category for what he actually did, so they kept the old one. Officially, on paper, Vivien Thomas remained classified as a technician at janitor's pay. Inside the laboratory, he was already in charge of the most advanced surgical research program in the United States. In 1943, a paediatric cardiologist named Helen Taussig walked into Blalock's office. She had been studying babies with a 4-part congenital heart defect called tetralogy of Fallot. The defect starves the lungs of blood. The infants are born blue, struggle for oxygen, and most die before their second birthday. Taussig had a question. She asked, could a surgeon reroute the circulation? Could you take an artery from somewhere else in the chest and reconnect it to the pulmonary artery so the blood could finally reach the lungs? The credit for the idea is hers. This is where many tellings of this story go wrong. Helen Taussig is not the injustice in this case file. Her name on the paper is correct. She conceived the procedure. She diagnosed the patients. She belongs there. The injustice is the absence of the third name. Blalock turned to Thomas. He said, "Figure out how to do it." For 18 months, Thomas worked. He designed instruments. The surgical needles available in 1943 were too thick to suture an infant's pulmonary artery without tearing it. He had thinner ones made. He worked out the angle of approach, the length of the incision, the order of the clamps. And he tested every variable on dogs, approximately 200 of them. The exact number is in his autobiography, Partners of the Heart, published after his death. One of those dogs was named Anna. She survived multiple experimental anastomoses. She lived in the laboratory as the proof that the procedure was viable in a long-term living subject. Her portrait still hangs at Johns Hopkins. On November 29, 1944, the first human patient came to the operating theater. Her name was Eileen Saxon. She was 15 months old. She weighed 9 pounds. She was profoundly cyanotic. Her lips and fingernails were blue. Without surgery, she had weeks, possibly days. Alfred Blalock had performed the technique exactly once, in the laboratory, with Thomas guiding him. Thomas had performed it almost 200 times. So Thomas was brought into the operating theater. He was not allowed to scrub in. He was not allowed to make an incision. He was a technician. He stood on a wooden stool behind Blalock's right shoulder. From that stool, for the entire procedure, he told Blalock where to cut, where to clamp, where to suture, and at what angle. Blalock followed every instruction. The operation took roughly 90 minutes. When the final clamp came off, Eileen Saxon's lips turned pink for the first time in her life. Blalock, looking down at the anastomosis Thomas had walked him through, said the line that would later become the title of a film about all of this. "This looks like something the Lord made." Eileen Saxon survived the surgery. She died the following year. The technique itself was sound. 2 further operations in 1945 on Barbara Rosenthal and Marvin Mason confirmed that. By the end of 1945, surgeons were traveling to Baltimore from across the world to learn the procedure. In May of 1945, the Journal of the American Medical Association published the paper. The title was "The Surgical Treatment of Malformations of the Heart, in which there is pulmonary stenosis, or pulmonary atresia." The authors were Alfred Blalock and Helen Taussig. The procedure became known as the Blalock-Taussig shunt. Vivien Thomas, who had designed the technique, perfected the instruments, performed it 200 times, and stood on the stool guiding the first human operation, was not mentioned. He did not leave. He spent the next 34 years inside the surgical training program at Johns Hopkins. From 1945 to 1979, every surgeon who learned cardiac surgery at Hopkins learned it from Vivien Thomas. He trained Denton Cooley, who would later found the Texas Heart Institute. He trained Alex Haller, who became chief of pediatric surgery. He trained Rowena Spencer, one of the first women board-certified in surgery in the United States. The list runs to dozens of names, almost all of whom became chiefs of cardiac surgery at major hospitals across America. The trainees called Alfred Blalock Dr. Blalock. They called Vivien Thomas Mr. Thomas. But inside the operating theater, when a trainee was uncertain, the question they asked was, "Mr. Thomas, are you watching this?" His hands were what they obeyed. He did this without a college degree. He did this on a salary that, well into the 1960s, was lower than that of white technicians in other departments with a fraction of his responsibility. He took a second job, bartending at Johns Hopkins faculty parties to support his family. Some of the surgeons he served drinks to had been his students that same afternoon. In 1976, Johns Hopkins University awarded him an honorary doctorate. He was 66 years old. The initiative did not come from the institution. It came from the surgeons he had trained. They collected signatures, lobbied the trustees, and made the case that the man who taught them did not have a single piece of paper to confirm it. The doctorate was honorary. It was 34 years after he had arrived at Johns Hopkins and 31 years after the JAMA paper that had not named him. He died on November 26, 1985, of pancreatic cancer. He was 75. His autobiography was published the following year. In 2004, HBO released a film called Something the Lord Made, with Mos Def in the role of Vivien Thomas. It won 3 Emmy Awards. In January 2020, Johns Hopkins officially renamed the procedure. It is now, in its own institutional records, the Blalock-Taussig Thomas shunt. 75 years after the JAMA paper, 35 years after his death, the portrait that hangs in the Blalock building today shows him in academic robes, holding the honorary doctorate. There's a name on the patent. There's another name on the work. Subscribe. We'll find the second one.